coming off is the aorta, and this is the brachiocephalic. It goes into the carotids, the right and left.
Okay.
And then these are the subclavians right here, and it comes in. It becomes the branchial down here. Brachial.
I'll put an end in there.
Okay. Do we need to know these at all? Okay. And this is also a subclavian over here.
Correct.
The aorta comes down into the bronchial, which is down on the side, and this is
Okay, it's just aorta. It's just,
okay, descending aorta all the way down, and then the first one that comes off is the something with a C.
Celiac trunk?
Celiac trunk. Yeah, and then the celiac trunk, the first one off of it, is that the hepatic?
Is it going to the liver?
No, it's
Okay,
not.
then it's not the hepatic.
Okay. Is it the splenic?
It's going to the spleen. That's part of the spleen.
Okay, so splenic, and then this is the.
It's going to the spleen.
So this is also.
Splenic.
So both of these are the splenic then. So this is the celiac trunk. This over here is the hepatic. These two, or one.
That's the hepatic.
Down there.
Because these are going to the stomach.
Okay, so are those gastric?
Yes. And so the hepatic actually comes in lower. You can see it's lower down. It's the first branch off the celiac. Here,
Okay.
if you look, it's going to be about right here. They come out very close.
Okay.
That's the hepatic. It's going to go under the stomach
Mhm.
and goes to the liver. These two are going to the stomach, and so these are both gastric. It's split early.
Okay.
And then this trunk, technically, once this splits off, this is now splenic. The fact
For
it's
both
split,
of them?
yes, the fact
Okay.
it's split doesn't matter.
Okay.
It's splenic.
Okay. And then this is the hepatic portal system, the yellow.
It's part of the hepatic portal system.
Do we need to know the specifics of like what
Some
each?
of these are the splenic, and then they go into the superior mesenteric. That's all.
Okay. I thought this one right here was the superior mesenteric.
That's the superior mesenteric artery.
Okay.
Because back here with the hepatic portal system, you've got all this. There's the superior mesenteric vein. Is this very large vessel, which is that.
Okay, so this is the superior mesenteric vein, and they come in the same place, which makes sense.
The
Okay.
yellow one.
Um,
The hepatic portal system is yellow.
and then let's see.
And then you had the superior mesenteric artery.
Yes. And then the next one off the trunk, I don't know if it's the next one or not, but this one right here is the renal artery.
Yep.
And then following down, mine is kind of ugly color. This is still the artery. And the next one that comes off is this one, which goes to the colon, but I don't remember what it's called.
Well, it's the inferior.
Wrong page.
It's the inferior mesenteric.
So this is the inferior mesenteric. Superior mesenteric,
'Cause it's
inferior
towards the head.
mesenteric.
It's towards-
Okay. Okay. So, and then the next one that branches off, so this is the external iliac.
Mhm.
This one right here. Correct?
Yep.
I don't think we need to know this one.
No.
No. And then when it branches here, this is the,
You're waiting here. You've got the femoral and the deep femoral.
right, so this is the femoral. Is this the deep femoral? Or is that one the deep femoral?
Deep femoral is farther. So you've got all the arteries. Yeah. So it comes out. The internal iliacs are inside. You get external iliac coming off, and then as we go down, we get the deep femoral. Ought to be.
Down here?
This is the deep. This is the deep femoral coming off.
So from here down.
Because it's going deep. It goes
Oh, okay.
deep. These are just. Don't worry about those.
Okay.
Those are not vessels we're worried about.
Okay. But back up here, so these two branches, so this is the internal iliac.
Yep.
Right there. So external, internal. The internal goes into the.
We only trace the internal iliac.
Okay, so we don't worry about all these things
No,
coming off?
no.
Okay. I think that's the majority of
Arteries.
the arteries. Okay.
Do we have to find caudal too?
It's in there, but
Okay.
the way to find the caudal is just right from coming straight, the caudal's right there.
Okay.
But it comes straight off this branch of the internal iliac, so way down here is the caudal artery vein. Way on the inside.
Okay. Is this some sort of?
Yes,
And-
it is some sort of,
Okay.
it's a vas deferens.
The vas deferens. Is that what goes into the testes?
What comes from the testes to the urethra, it transports sperm out of the testes to the urethra there. That's the
Okay.
vas on that side, and there's what should be one on the other side.
So it's one big loop, right?
Forms a loop. There should be one looping from the other side, but it could have got, no. Let me see what's there.
I think
Oh,
It was.
it has been severed.
Yeah, so he's had a vasectomy on that side.
Uh,
So those are the two vases, and you just, this one's gotten cut. This one
This-
is attached to this.
right there.
Mhm.
Okay.
Mhm.
And so then here's the testes, and it's wrapped in that sac thing that I forgot the name, the epicardium? No, that's definitely not it.
I think that's the UG system wrapping around the testis is the tunica albuginea and the tunica vaginalis. That's under UG systems. Testes.
Epididymis?
Well, the epididymis surrounds it,
Right.
but you have in the scrotal sac the tunica vaginalis and the tunica albuginea are part of this the leathery covering which you removed, which is good. And then you have that's what this is.
So this
These two
is
layers.
the tunica vaginalis and the tunica
Albuginea.
albuginea. Both of these are this one thing?
Yes.
How do you
they're
distinguish
together.
between
We're
the two?
not gonna worry about it.
Okay.
But they surround it there, so as it says, the fibrous coat of the testis proper is this.
Right.
And this is peritoneal covering. They're subtly different, but I can't separate them.
Okay. That's
And
fine.
then the epididymis is what surrounds the testis. So you have the testis proper and then the epididymis. You can see it wrapping around the testis.
So is that this, like,
Yes, so the epididymis is, the testis proper is right here. This is epididymis. If you, this is epididymis
okay.
to the left.
Yes.
And so if you were to follow it, this is the head and the tail of the epididymis, and then way down here, the vas begins way down here.
The
It
vas deferens.
travels this way, all the way out.
Okay. Perfect. And this is the fundus, and then it goes down into the urethra, which is underneath. Do we need to cut this open so we can see it?
The only reason to cut that open would be on the male is to find where
The
vas
prostate.
deferens attached to the urethra is where the prostate is. On some cats, if you sort of push things around a little bit, you can see where they attach without splitting the pelvis. On some cats, you may have to split the pelvis to see the prostate.
Okay. I'm looking for the prostate, but I guess I'll just have to go deeper. Okay. Nina, do you have any questions? The only other thing would probably be the ureter, and make sure that we get the right one. Is that this thing right here?
That's the ureter you did, because you can trace it all the way from here.
Right.
All the way down, it attaches to the bladder.
Right.
So the ureter, you may have a little bit of other junk with it, but it's the
Okay.
the ureter's in there, and it's fairly big. It's fairly wide.
Yes.
It's just a tube.
I think everything else I can find. This is the adrenal gland. Yeah.
Mm-hmm.
Okay. Do we also need to know veins?
Of course.
Of course.